Hi, everybody. Welcome. I'm like, who's starting this week? Welcome to our 57th community webinar on coronavirus. I am Yvonne Lewis. I'm your moderator for today. Wait, no, wait. Oops. I'm not Yvonne. I'm not Yvonne. I just play one. I just play her on the webinar. Yvonne is out today. Uh, bless her heart. She more than deserves a day off. And I think this day off was forced on her by her wonderful children. But we got a great lineup today. We've got all of our partners here from the Healthy Flint Research Coordinating Center and others. I just want to acknowledge 57 amazing weeks of partnership and all of these just, hardworking, really great people who've rolled up their sleeves and done the work with us. So I want to be one of the presenters. So I'm going to hand it over now to my colleague, Dr. Helen Uphold. She's going to take it away and tell us how the session is going to go today.
I will. Thanks, Dr. Deb. We do have an exciting session today. We're going to be getting our weekly vaccine update. We're also going to be talking about advanced care planning. We'll hear about community spread of COVID. So that's our update on case counts and our health policy equity update, and then your health, your choice will also be covered. But before we get to that, I have a couple of reminders for us. April is National Minority Health Month, and this year's theme is active and healthy. So we want to remind folks to get out, get active, and stay vaccine ready. We also are celebrating today, April 16th, is National Healthcare Decisions Day. So that's why we're talking about advanced directives. And it's important because it exists to inspire, educate, and empower not only the public, but also providers about the importance of advanced care planning and having that conversation. Before we get into those topics, we want to have our roundtable discussion. So Dr. Reynolds, take it away. Fill us in. What's going on with the COVID surge? Where are we at?
All right, let me say on the onset that I am very concerned about the spread in Michigan. You will see that we lead the nation in new cases and spread, and this is a very serious situation. Vaccination is an important part of the response, and it's necessary and essential, but there are also layers of protection that we must follow, and we'll get into those layers later on in our discussion. But most concerning is that our governor has not asked that we shut down. Flint Community Schools looked at the numbers and decided to shut down. Carmen Ainsworth and one other district decided we'll suspend athletic activities. Now, why is this so important? Well, besides the people on the field and riding the bus to the event and the people in the stands and the restrictions on the number of family members in the stands that were removed, and all the activities that happen before and especially after an athletic event, all the social activities, they facilitate or make it easier to spread the coronavirus. And so we have to be very attentive to what we do now, especially because there are mutations. Now, some people will say, and I hate to say, including the governor, that we should vaccinate. And she's right. That's for step one. But for step two, we still have to do all those layers of protection, because even if we had the J&J vaccine, it's 2 weeks after you get the vaccine that you have protection. And then if you get the other vaccines and you complete your course, it's up to 6 weeks after you get your first and second vaccine. It's 2 weeks after that you have adequate protection. So essentially, we are delaying a response for at least 6 weeks. And we've seen what's happened between February 1st and now April 1st. And we don't have the breathing space to take that risk. Our hospitals are full. Our hospital staffs are stretched and not getting time off. We are in a critical situation, and more, I'd say alarmingly, is that the disease, since we started vaccination, has shifted to younger, unvaccinated folks. And they get around a whole lot better than people in my age group, and that increases community spread. So if we are going to follow a plan, then we should review what's in the Safe Start plan of the state of Michigan and see how closely we are adhering to schools, took a look, and they said, wait a minute, we said we'd close schools at 9%, and at the time, we were up to 17, 18% positive tests at that time. So this is not something that everybody wants to hear, but you sure don't want to hear the ventilator swooshing in your ears while you're laying on your belly in an ICU, or you can't get to see a loved one because hospitals have limited guests to limit the spread of the COVID-19 disease. And I think I've said enough today.
I would add just one thing to that, and it's a great place to pick up where you left off, is that what a lot of people don't realize is when cases go up, we've gotten a lot better at identifying COVID and treating it. So we've got good therapeutics now. I think there's a lower rate of people getting on ventilators when they go into hospitals because they're able to get a lot of therapeutics that will help them before a ventilator is needed, but they're still having to be hospitalized. And many of our hospitals are at or over capacity now. And we remember what it was like at the height of the pandemic when we had, we saw pictures of people in gurneys in hallways and on tents out in the parking lot. We just don't want to get there. And I remind people, we were able to flatten the curve in Michigan without a vaccine. The vaccine was supposed to be that extra added layer of protection that was going to tip the scales for us, but it wasn't meant to replace all the other things that we were doing. The real power of it is running all of these layers of protection at the same time. So the need for personal responsibility and people to practice good public health that's in their hands, wearing your mask, washing your hands, watching your distance, plus the ongoing governmental support with restrictions around, large gatherings and, suspending in-person, certain in-person activities and sports and things like Dr. Reynolds was pointing to. We actually need all of those things to be happening at the same time. We will not singularly vaccinate our way out of this problem. And the vaccine is really important. So I just urge people, this is not the time to take our foot off of the gas. It's going to take 6 to 8 weeks from when we start putting it all together for us to see the shift. So the longer we delay in getting ourselves together, the longer we'll see a delay in a turning of the tides and bringing those case numbers down.
Susan, can you chime in on this? Dr. Wolford, what's your perspective?
Oh, absolutely. I totally agree with what's been said. I feel that definitely we need those restrictions. I also think that if we were in a physical war, no one would have to tell us to hide in our basements. No one would have to tell us to close the business. We would be doing that because we would want to avoid that danger that's out there. The problem is that we can't see this virus, so we so easily forget it. And we're relying upon others to tell us to protect ourselves and the ones that we love. When we now notice it's impacting younger children, when it's younger people and children, when we had surges in the past, peds was, generally not the area that we were very concerned about, but it's beginning to spread in that area. And so I think we have to see it as a war. And we have to take protective measures. And we've heard those said, we have to wash our hands, stay indoors as much as we can, wear our masks, and get vaccinated if you can.
All good things to remember. We actually have someone else on that's a speaker today too from Hurley, and I'm curious if she has anything to add too. Diane, do you have anything that you can add to what's been said?
Well, obviously, I agree with everything you're saying because I do work at Hurley. I do palliative care. So I see the patients who are extremely sick, some who are not so sick. But I don't know if it's time to talk about kind of advanced care planning because that was part of our highlight today is that we want to talk about healthcare decision day. And I can't think of a better time than to talk about it now with don't wait until, people, I see patients every day that we talk about healthcare planning and like, oh, I'm not dying. Oh, that's not for me. It's not about dying. It's about living. And I just give you a couple examples of during the time of obviously COVID that's going on now, we have a lot of barriers for patients completing their advanced directive. Because number one, it wasn't done ahead of time, and they come in and they're either very acutely sick, very seriously in trouble, and we don't have time to really sit down and have a nice discussion about what their wishes are and who they would like to make their wishes known. Also, we don't have the resources to be able to have someone witness it because we don't have visitors, so we're not able to have their advocate come in to help them understand what their wishes are, or to have two people witness the document. So it's been very challenging to get that document completed.
So this is why we don't want folks to get to this point, although that's an important conversation to have, but these layers that Dr. Lawrence and Dr. Deb, Dr. Wolford have talked about are so important throughout maintaining protection so that we don't get to a ventilator situation or we don't get to another very similar situation. So.
Well, they're tough conversations too, because the other thing is during the peak of this pandemic, we had a lot of people who were not able to speak for themselves. And even worse, loved ones weren't able to be in the hospitals. And so you had a lot of these things being brokered by phone with loved ones who weren't able to talk to their loved ones who were in need. It was awful. A good colleague of mine is an anesthesiologist, and most people don't, if you don't not in healthcare, you don't know. There's almost always an anesthesiologist there when somebody's being intubated or being put on a ventilator. So he got to see some of the most sickest COVID patients, and he said it was just unfortunate that families had not had these conversations. And so then you have to sort of figure that stuff out on the fly. So I'm happy that we're, honoring healthcare choices today. And we're going to hear a bit about how that can go and what that can look like. And that we're also saying when it comes to this thing called COVID, we have strong tools to prevent the spread. As a public health person, I just cannot stress enough the goal with COVID. The goal with public health and the goal of the vaccine and the goal of herd immunity. It's not for people to get sick, some to die. We can recover, we can rebound. The goal is to prevent people from getting sick in the first place. Public health is all about prevention, and so I just can't stress enough how important it is for us to prevent the spread and the transmission. Spread is going to increase the number of mutations that we'll likely see. It's going to increase variants. It's going to come with unnecessary morbidity and mortality. Like we really just, this is like, I need everybody to freeze. Remember you were a kid and you play tag and somebody go freeze and everybody like freeze like this. That's what I need everybody to do right now. Like really stop, take inventory. And I'm not saying it's easy. And I love that we have Katie on. Katie, anything like any nuggets maybe you could offer us for people who are, very legitimately maybe even dealing with mental health crises or just, low grade problems or symptoms during this time?
Certainly, we are very concerned because the mental health of individuals has really been impacted. We've really seen it with children and individuals with substance abuse, really high numbers and increasing use of substances during COVID. So we are working diligently to support the community in the behavioral health arena. And I would encourage people to make sure they know about our crisis services and our behavioral health urgent care. That's very important. And it's 24 hours a day, 7 days a week, 365 days a year. And our urgent care, if you're just having a hard time, if you're professional and you're working in the community, in the hospital or whatever, and you're stressed out, you can call. If you have mental health issues, if you have a history or short history, long history. So keep in mind that these things are available, and don't forget about your mental health because it's so important. We're whole body people, not just our physical health. It's very important, but our mental health is really important too. And don't wait to reach out to get that help. And many of the services can be provided virtually, so you do not have to go, somewhere to receive some of these services.
Good stuff.
Is there a number for people?
Yes, our number is 810-257-3740. That's a 24-hour crisis number, 810-257-3740.
Thank you so much. Yeah, just because it's, it's funny. If we had a broken leg or you saw somebody with a broken leg, you wouldn't dare tell them just pick themselves up by their bootstraps and move on. You wouldn't tell them to go pray about it. You wouldn't tell them to stop being a baby. You take them to the hospital so they get that broken leg reset and cast and all those other things. Unfortunately, we oftentimes don't treat mental health and behavioral health with that same sense of urgency and the same sense of compassion that we look at physical health. So, Katie, we just appreciate all the great work of the Genesee Health System and making sure that those resources are available for people. I'm going to throw that number up in the chat also, just so everybody has it.
All right.
Thank you so much. Thank you so much, Dr. Deb, for saying that, because it is a really important component. So thank you so much.
Yeah, sure.
And thanks for being on with us, Katie. It's always wonderful to have these roundtable discussions and just be able to call on folks and just be nimble to the needs of our community and the needs that arise throughout the week. So thank you for joining us.
You're very welcome.
All right. So we still have go ahead.
Dr. Reynolds always said, if you want, you got to plan in COVID for things to change about twice a week, no less than twice a week. So if things are changing once a week, maybe you missed something. Because I trust Dr. Reynolds. And actually, when he said that, I thought it was really funny. And it's true. Things change no less than twice a week around COVID.
Dr. Deb, you had to take me there. So we might as well talk about the Johnson & Johnson vaccine.
Yeah.
There has been a condition of blood clots, especially in the brain, but other organs that has followed 6 people that we know of, all women, all white women who received the vaccine. And the reason I give you what we call race is we have to be vigilant in all communities. So when we see it in one area, we do have to ask the question, well, why isn't it happening in another area? But nonetheless, that is 1 in 1 million vaccines that have been administered. So it is a rare condition within a rare condition. And it usually happens 8 to 14 days after someone has received the vaccine. And usually it's headaches, it's leg pain, it's abdominal pain, it's swelling and bruising of a leg. So if we see those things, if you have received the Johnson & Johnson vaccine before it was stopped being given, if you see these things in the next 7 to 14 days, you should see your doctor and let them know that you did receive the vaccine. Now, back to what we say today may change tomorrow or next week. The CDC and the FDA are meeting now, going over the data to see if there's actually an association. And actually, this is one of the successes of this vaccination campaign and our response to COVID. We have always had a vaccine adverse event reporting system that's available, and that's how it was picked up. So if you have a problem with any vaccine, not just the COVID vaccines, but any vaccine, you can go to this website and you can file your symptoms, and you can also let your doctor know, but they will call you back or they will be in communication with you. So please, if you have a problem, take advantage of those resources that are available. And if you don't know, ask somebody. And if you go to our county health department website, you will find all that information. If you go to our state health department website, you will find all that information. But I repeat, they're investigating a very rare condition which occurs within a family of very rare conditions. And So we will get through this, but I really appreciate the diligence and the speed with which the CDC and the FDA is intervening and investigating.
Yeah, and we just put the info up in the chat. There is actually a website that's managed by HHS for the vaccine. It's called Vaccine Adverse Event Reporting System, VAERS.HHS.gov. And you can go there and report any adverse events. People, I've heard a lot of sort of rumblings from people that they think there's some kind of cover up going on. And I just want to reassure people, it's not how this works. And you do have a reporting process, and you will be followed up. Because the other thing that I remind people of, and I think it was so great that Dr. Wolford talked about this last week, is that people are developing blood clots, whether or not they have the vaccine. People are developing cardiovascular disease. Everything that was happening pre-COVID is continuing to happen. And for some of those things, it's accelerated. They say obesity is going up. Do you know because of COVID last year, the average life expectancy in the US has gone down by 1 year? We've shaved 1 year off the average life expectancy of an American. So there are all these things that are going on. And so it's important that people monitor their health. You could have a blood clot unrelated to having a vaccine. And my colleague, Dr. Edwards Johnson, who sees patients in East Lansing, says 16% of their COVID patients that are in the hospital develop blood clots. I'm just like, so what that makes me think of, when you compare the 6, and we don't know if it's causal, but the work is being done. When you compare 6 blood clots in women out of 6.8 million doses that were given to potentially 16% in a hospitalized population, you'd much rather have the vaccine than the virus. And I will leave that there.
Right. Thank you all for breaking this down for us, helping us to make sense of this, helping us to understand it. It can be so confusing at times, but this reassurance and this clarity is so helpful. So lovely roundtable. Thank you. So let's get into the good stuff also. Thank you, Marley. Here we go. Normally we get our update from Gary Jones. He is from the governor's office, but he's out of the office today. So I do recommend that you email him if you have any questions, or to receive his weekly updates. If you're not getting those, contact him. He's got his phone number, which is 517-282-3193. But you can also send him an email at jonesg9@michigan.gov. That's JONESG9@michigan.gov. And then the catch-all website for everything coronavirus related to the state is www.michigan.gov/coronavirus, and you can get all of that information. But Gary really does send out some great emails. So if you're not getting those, send him an email, and then he'll put you on his list. And it is good. I get several of them every week. So I'll make sure that you're getting those. So Shirelle Brown, she is the emergency preparedness health educator at the Genesee County Health Department, rather. And very often Shirelle is coming to us from a vaccine site. Many of you might not know, but she spends a lot of her days in vaccine sites. So Shirelle, what do you have for us this week?
You're probably being really brilliant on mute, Shirelle.
I am on mute. I'm sorry. Good afternoon. So I just like to talk about what's happening in Genesee County. On the dashboard, you can see that we've administered in a county effort almost 200,000 doses of vaccine, and from the health department, a total of a little over 62,000. So we are getting vaccines in arms. Right now in Genesee County, over 80,000 individuals are fully vaccinated, which is about 20% of the county's population. So we're doing well there. Our progress is steadily increasing. Needless to say, we would like to see an increase in that number, especially since we are seeing a steady rise in COVID-19 cases. Next slide, please. So in the last few weeks, over 250 plus new cases have been recorded and reported per day within Genesee County. We're also seeing some variant cases. In Genesee County, we have the UK strain as well as the South American strain. Yesterday, it was reported about 81 cases of the UK strain in Genesee County. So these new variants, they do spread easier than the original strain of the COVID-19 vaccine. I'm sorry, of the COVID-19 virus. So we want to make sure that you get your vaccine and that you continue to get tested. We've also seen our positivity rate to increase to about 20.3% in Genesee County. And part of the reason for that is because there is a lack of testing. So we encourage you to continue getting tested on the monitor. You'll see some of the testing sites where you can receive a free COVID-19 test. We have sites at Word of Life, Bethel United Methodist Church, as well as Macedonia Baptist Church. You can also get a free COVID-19 test at your local Walgreens or Rite Aid, our Hamilton Community Health Network, and Genesee Community Health Center. So we have multiple point of dispensing sites for the COVID-19 vaccine. Currently, we are doing drive-through clinics as well as indoor clinics. Two of our drive-through clinics are at the Bishop Airport as well as Flint Northwestern High School. And then we have some other indoor clinics at Our Lady of Guadalupe Church, Central Church of the Nazarene, Shiloh Missionary Baptist Church, Grace Emmanuel Baptist Church, and the North Bank Center at U of M Flint. Coming soon, my community college will also be a place where you can go get your COVID-19 vaccine. And I do want to let you know that you can schedule an appointment during business hours with Genesee County Health Department by going to visit gchd.us or gc4me.com. Currently, there's no pre-registration. You're just going to visit those websites and click the COVID-19 vaccination information tab, and you can schedule your own appointment there. So we are offering currently Pfizer and Moderna vaccines. We're all aware of the pause on the Johnson & Johnson vaccine. So if you've had appointments scheduled for Johnson & Johnson, please know that we are still valuing your appointment and you will be given Moderna or Pfizer instead. If you do not have access to the internet, you can still call the health department at 810-344-4800, and someone can walk you through the process or get you scheduled for an appointment. And I do want to make sure that parents know, if you have a child who is 16 or 17 years old, when you're on the website scheduling for an appointment, you want to make sure that you schedule for a Pfizer vaccine. That is the vaccine that has been passed to be given to our 16 plus population.
All right, good information. So one quick question for you, Shirelle. So this is a new development. We don't have to pre-register, so we just go straight to making appointments now, right?
Correct. You're gonna go straight to making appointments. Every now and then we will host walk-in clinics as well, and those will be posted on our Genesee County Facebook page. So our Genesee County Health Department Facebook page. So be on the lookout if you're having a hard time scheduling an appointment on our website, or if for some reason you can't get through on our phone line, check our Facebook page. Every now and then we are advertising walk-in clinics for Moderna and Pfizer.
Okay, all right, good stuff. And thanks so much to everybody who's tuned in today, who are putting questions in the Q&A. I do see that someone put one in that Dr. Reynolds wants to answer live. So if we could do that right now, that would be wonderful. Dr. Reynolds, do you want to take that question right now, since we're talking?
Oh, yes. If I'm looking at the question, how long should one wait to get vaccinated? First, I'll talk about a very specific treatment for COVID-19 disease. If you got monoclonal antibodies and you will know it because it's an IV treatment and you have to hang around a facility for a while, you should wait 90 days. But if you have had COVID-19 without that antibody treatment, it's reasonable as soon as your symptoms clear up, you should consider getting that vaccine. And I'd say about 2 weeks is a reasonable time for you to go get treated after your symptoms clear up.
Okay, all right, good to know. All right, see, this is the wonderful aspect of this webinar, that we can get your questions answered live and in real time. Dr. Deb, do you have something to add to this?
Yeah, this came up on a live talk that we did. Someone got their first dose of vaccine and contracted COVID in between getting the first dose and before they got the second dose, and asked, are they still advised to get the second dose? And again, remember, we're all learning, right? We're all learning. The information is sort of unfolding in real time, and the scenarios are unfolding in real time. And the recommendation now is yes, but it's in line with what Dr. Reynolds said, after your symptoms have subsided. And it taps into this other question that's been posed. If somebody's had their first dose but can't make it for the second dose, what's the proper way to reschedule? Maybe Shirelle can answer that. I don't think there's one answer for that because it depends on how you got scheduled in the first place. But what I will say is I'm asking everybody to be good stewards of the opportunity. So if you have an appointment and for whatever reason you are not able to make it, you need to inform the provider that you will not be there. Missed appointments lead to waste. And so be a good steward of the opportunity. So if you are not able to, for whatever reason, because you've contracted COVID or you're ill or something comes up, make sure that you're in communication so that appointment can go to somebody else. Shirelle, do you have advice for people on what to do if something happens and they need to reschedule the second appointment?
Yes, and I'm glad that you put me back on, because I do want to touch base on the fact that if you received your first dose from an entity outside of the health department, we do not honor second dose appointments. So you must get your second dose from the same place you received your first dose. So I do want to make that clear. We have gotten calls about that. And if you have received your first dose from Genesee County Health Department and you missed your second appointment or cannot make it, you can visit those two websites, gchd.us or gcforme.com. And what you're going to do is you're going to schedule again for another appointment. The recommendation is that you try to get that appointment as close to the time that you were due for that second vaccine. If you're having trouble with the website, call us and we'll get that taken care of. Again, that phone number is 810-344-4800. Please do communicate.
Awesome.
All right.
We got a couple more questions in the queue too. I guess we'll come back to those maybe after this.
All right.
Yeah.
Sounds good. So our next topic, we are going to hear from Nicole Smith-Anderson. She's the Special Projects Director at the Greater Flint Health Coalition, along with Diane Welker, who is a nurse practitioner in the Pain and Palliative Care Department at Hurley Medical Center. And they're going to be talking to us about advanced care planning, which may seem like a difficult topic, but it's one that we all need to be prepared for. So ladies, thank you for joining us today.
Thank you so much. I know we've been kind of tiptoeing around it, so it is a nice opportunity to be able to share. So when we talk about advanced care planning, it's really the process for planning out those future medical decisions. And when we start to have these conversations and we start to build out this process, we really want to do a couple different things. We want to reflect on your own goals, your values, your beliefs. So really thinking through any sort of personal, cultural, or spiritual implications. Having a good understanding of also possible future situations is really important. I mean, there's a lot of things that could happen. And so trying to get a good handle on what could occur is really important. And then also a major component of the advanced care planning process is having these conversations with your family members and your loved ones, because, you know, managing this by yourself is very tricky. And so we want to make sure that we're really having conversations with those individuals, especially the ones that might actually have to carry out these decisions. So if we want to move on to the next slide, looking at why advanced care planning is important, you want to make sure that you're able to choose your patient advocate. So that person that's going to be responsible for everything. You also want them to know what your healthcare wishes can be. And I think this is really, really important. And a little later on, we talk about how it reduces stress on your loved ones. And these conversations are very difficult to have, and they're not fun, and people don't want to think about it. But if anyone's ever been in the situation where they're having to make decisions for someone else and they have no idea if they're doing the right thing, it's a terrible position to be in. And so really, when we talk about advanced care planning, we really think of it as a gift that you're giving your family members, because you're not requiring them to second guess any of their decisions. It's very, very clear about what you want and kind of what your expectations are. So within Genesee County, we're actually really fortunate to have a lot of fantastic resources. And if for anyone that hasn't visited yourhealthierchoice.org, I would encourage you to do so. So this is a project that actually is housed through the Health Coalition, but it's in partnership with the 3 local hospitals. And so one of the things that we want to make sure is available is we want people to be able to have a facilitation appointment. So an advanced directive is complex, and Diane will talk a little bit more about it, but it's not something that you can like print off and fill out in 10 minutes. You really want to think about it. You want to have some conversations about it. But what we're able to provide is, if you go on this website on the right-hand side, kind of halfway down the screen, you can request an appointment, and we'll reach out and we'll get you connected to a trained facilitator that can really walk you through the process for advanced care planning. And this is something that's completely free for all Genesee County residents. And so it's something that we really want to make sure that everyone is aware of. On the next slide, we also have kind of just a couple images of some of the resources that we have available on the website. All of these you can download. So it's information booklets, it's a planning guide. We also have a lot of fact sheets, because when we talk about the considerations that you might want to make, you might want to learn about tube feeding and CPR and what the difference is between a living will and a durable power of attorney. And so all of these resources are available. And any organization that's kind of on the call today, if you want these at your facility, let us know. We have plenty of hard copies that we are more than happy to kind of hand over to you. And so now I'm going to hand it over to Diane, because she really does a fantastic job with all of this. She's one of our ACP superstars in the community. And so I'm just going to let her talk a little bit more about the importance of advanced directives.
Okay, thanks, Nicole. This has been a passion of mine for many years. When I worked in surgery many years ago and learned about asking patients about advanced directives, and learned there's a lot of people that don't know what they are. And again, like, oh, I'm not going to die during surgery, am I? So I kind of learned a lot about how to talk to people about this. And then we're fortunate that the Greater Health Coalition brought all 3 hospitals together, and we are so pleased that all of them have come up with a form that we use consistently. There's a sample here, but as Nicole said, there's the resources on the Your Health, Your Choice website. But as I said earlier, this is a process. This isn't something that you complete in 10 minutes. That's why it's helpful to get an appointment. But the basics of the document is, first of all, you're going to select an advocate, and the advocate can be anybody. It does not have to be a family member. When I sit down and ask people who they want their advocate, oh, it's my husband, oh, it's my son. That is not always assumed. And in Michigan, we do not have the family consent law. So really, this is what is highly recommended, that an individual selects another person to be their spokesperson. It could be a friend who's a nurse. It could be an uncle who's a doctor, somebody that they trust in the medical profession, or it doesn't. It could be just your oldest daughter that really knows you the best and is going to follow your wishes. So, and sometimes it takes, I had, one couple, and it took them a week to decide who they wanted to be their advocate. It wasn't each other, but that's okay. And then the next portion of it is obviously selecting those wishes, and those wishes are sometimes very difficult, sometimes very easy. Sometimes patients have had family members that have went through this before and they know exactly what they don't want or they do want. But I get the pleasure of reviewing every single one that comes through Hurley Medical Center. And I'm really excited because I'm seeing more and more come through the medical center. Before we didn't have patients that completed these. So I'm very pleased that we see them. But I do enjoy reading these because it really tells what's important to that individual. There's no right or wrong answer, but it's what is important to the person that is requesting their wishes. And we use it as a tool, just like your medical team uses a stethoscope, an X-ray, an MRI to determine what the next plan is. This is my tool that I use when I'm talking to patient's family as to what the next step is. And again, it's just a tool. It's not right or wrong. It helps guide the family. And as Nicole said, this is a gift to family members. This was one that we cut out because it's very clear and it's in the patient's own writing. If I'm unable to communicate meaningfully with my family, I do not want my life prolonged. I want my brain to function as it is now. And if it's not, I do not want my life prolonged. Very, very simple. And you can get as detailed or as minimal as you want. But the more information, the easier it is for your family. And I pulled out a couple examples, and these just because they were COVID and I thought they applied to our discussion for today. But these were 3 patients that I dealt with. And one of them was a 76-year-old female with advanced COPD. She was admitted with COVID pneumonia. And as you all know, COPD lungs are a lot more compromised and coming in with COVID pneumonia. She had an advanced directive already completed. She appointed her oldest son as her advocate. And she wrote on there, she indicated that she was on a ventilator for more than 2 weeks and she was not waking up to tell her grandkids she loved them, then let her go. Life was not worth living. And she had completed this 10 years ago. So this was way before COVID. But this was such a gift for the son to be able to say when is when. And so it really helped guide us in her treatment plan. The good thing is that she was able to wean off the ventilator. She was put on the ventilator when she came in, but she was able to be weaned off the ventilator before we even have to follow through with this. I had another gentleman, he was a 92-year-old who had unfortunately advanced dementia. He resided in a long-term care facility. He was admitted for COVID. He needed a ventilator. He needed dialysis. He needed a feeding tube. Unfortunately, there was no decision maker. He had a lovely wife of 87 years old who I had to talk to on the phone because she could not come in. And unfortunately, she really did not have the insight to understand what was going on with her husband. There was no children, there was no decision maker. And unfortunately, since we did not have these things in place, this gentleman suffered a very horrible passing. Another patient was a 51-year-old. She was admitted for COVID pneumonia. She already had multiple sclerosis condition and other medical issues. She was willing to complete her advanced directive. However, she was very adamant that she wanted her sister. She had 2 kids in their 20s, and she was very adamant that she did not want them to be placed with the burden of decision-making with her condition. And unfortunately, she was able to express that she wanted her sister, but due to COVID and the seriousness and the quickness of the events that occurred, she was placed on a ventilator. We were never able to establish that in a written document. So again, I can't emphasize enough that you do that ahead of time. And on the directive itself, on the back page, it basically states the 5 situations and when you really want to look at this advanced directive. Every decade of your new life, if you experience death of a loved one, a divorce, diagnosis of a new condition, or a decline in a medical condition. So basically, those are the 5 Ds when you really should look at getting this done.
And thank you so much, and Nicole, for joining us, sharing these real stories, just to normalize this process and really help us to provide this gift to our family members. It's I think it's so needed, and we're so grateful for you guys joining us today for our webinar. So thank you. Let's transition to our wonderful Dr. Susan Wolford, who is an associate professor with U of M. Dr. Wolford, what do you have for us today?
Thank you so much, Helen, for this opportunity to speak today. I'm going to be speaking about choosing to change. So we all know at this point by now that there are those of us who are increased risk for getting severe outcomes with COVID, right? So if you have diabetes, then you are at increased risk. We know that if you have heart disease, you are at increased risk. We also know that if you have problems such as high blood pressure, that will increase your risk of severe problems with COVID. And if you have some underlying lung disease as well, that puts you at increased risk. But of course, the important thing about COVID is that anybody can get it. And it's a bit like rolling a dice because you don't know who's going to have poorer outcomes than others. We know that starting off, there were elderly were the ones who were having the greatest number of cases. But now that more of them are protected by the vaccine, we're seeing it happening or affecting younger people. And so we think to ourselves, what can we do? Obviously, the vaccine is working to a large extent, and that's why it's protecting the older population. And so those of us who can get the vaccine should get it. If we need protection from COVID-19, we should go ahead and get the vaccine. We can do the things we talked about, right? 20 seconds of hand washing can help avoid COVID from spreading. We can show that we care by what we wear, by wearing a mask and wearing it properly. And then we can be engaged in social distancing. And we know that this is very, very hard, but we need to remember, as we talked about beforehand, we can have our social bubble, right? Where we can protect ourselves with those who are in that bubble. And, you know, if there are others who are vaccinated, you could create a bubble huddle so that you're not feeling quite so isolated. So those are things that we can do. But we all need to just stay as healthy as we possibly can, because we know that is how we can have an effective immune system as one of the important layers of protecting us against COVID. And so when we think about being healthy, I don't think we need to have a scientist to tell us that it's about what we eat, whether we exercise, and whether we sleep. Really important things. And if we think about it, if we start with just thinking about what we eat, do you know that only 9% of us in the US get at least 3 servings of veggies every day? I mean, 9%. So pretty much very, very few of us. So most of us have to think about changing. And how can we change? Well, there are 2 things we have to think about changing. Why change is the first question. Well, that's easy to answer. We're changing because we want to avoid COVID. And how to change? Well, how to change is a little bit harder. And there are a lots of research on this. I'm going to stop sharing my screen now because I want to show you something. So you can make me full screen. I don't know if any of you are noticing my little bars of chocolate that are around me. If I want to change my eating habits, you will know that one of the things that people will tell you to do is to have willpower, right? So I love Cadbury's chocolate. And if this is lying around me, I am going to eat it. The studies show that trying to have enough willpower not to have the things that you shouldn't have really doesn't work terribly well. What does work if you want to change your predicament where it comes to healthy eating and health? One really has to change one's environment. So either don't bring it into the house at all, or if it makes its way into the house, I suggest that we destroy it. Now, one would say throw it in the bin, right? But how many of you have thrown away something in a package and picked it back up? Do it exactly. So this time I want to just demonstrate destroying it in a way that it cannot come back. Crush it up, smash it up, clean up by spraying it with cleaner. We are not going to be able to eat this chocolate anymore. We want to get rid of it. It's there. Even to me, it's not a temptation anymore. And surround oneself with things that are good for you, that you really want to eat. If there's nothing else in the house, you ultimately will eat the kale. So that is my advice for today. Try to focus on making our health as just in tip-top condition by removing from your environment the things you don't want to have and replacing it with the things that are better for you. So with that, I'll try and get rid of this one before I eat it, and I'll go back over to you, Evelyn.
That is wonderful. Thank you so much, Dr. Wolford. All right. Now we're going to head to Dr. Deb, and she's our leader in equity, my dear sweet inspiration. There's a lot going on. Fill us in, Dr. Deb.
All right. I'm just over here mourning the loss of that piece of chocolate, but that's okay. So our cases are continuing to increase in the county. This is what we mean by surge. Caught in the vicious cycle, things are going up. Genesee County is the third highest number of new cases in the nation relative to our population. People may have seen that in the New York Times. It's called the Flint metro area, but just know that that covers Genesee County. It's not a huge increase, but we were already really high. Our community case rate last week was 20.3%. This week is 20.9%. Again, I'm just stressing we need all those layers of protection back in place. We continue to have a problem with missing data on race. This to me is an unacceptable can that's getting kicked down the road. We've changed the chart up a little bit and put the unknown race data in bright red because it's like pants on fire. We have a problem. It's hard to say whether or not we've continued to keep that disparities gap closed when we can't even say with confidence, talk about the race of the people who are cases in the county and the city. This is just really, really unfortunate. So again, we are working with multiple stakeholders across the city to try to get this problem solved. And we also need good legislative action to require providers to collect and report this information. It's got to be a requirement, and that requirement has to be enforced. Okay, so next. You've heard about the pause on J&J. We're going to unpack that a little bit more next week. We will probably also likely talk about the vaccine trials testing that's happening with pediatric populations. They've now gone down to age 2. But what I want to leave people with is what we saw with the pause is a good thing. If we have any reason to suspect that we might have a problem, that is exactly what we do. We pause, we investigate, we figure it out. So the little temporary, hold tight is a good thing. I just encourage people, don't let that sway you too much in your confidence in these vaccines. It's a good thing. We are being transparent. We are doing the work to make sure that the vaccines that people are getting are both safe and credible. I'm going to toss it over to my colleague, Mary Catherine, because we only have just about 6 minutes left. So you take it away, Mary Catherine. Okay. What do we need to know from a policy perspective?
Okay, well, I'm going to toss my email and Rick's email into the chats if anyone has any questions, but our recommendations for policymakers. Let me just start by what Dr. Reynolds had mentioned. Michigan is the epicenter of the pandemic. The rate that we're getting shots in arms is great, and it surely has helped with the spread of impact and reduced severity of illness, but it's not enough to keep us from having some of the worst rates in Michigan in the nation. So there's not one sole cause to this surge, as we talked about, but we do know that some Michiganders are unfortunately falling short when it comes to our shared and personal responsibilities, including the most basic layer of protection, masking up. So pleas and calls to action for are simply not enough. We need our policymakers to take action with legislation that actually enforces the statewide mask mandate as more Michiganders refuse to wear masks in public and or private settings without punishment. So failure to fulfill one's obligation is the literal definition of dereliction of duty. And by not enforcing mandates that are in place, we're continuing to allow individuals to escape and proceed to not wear masks and flout public health laws with impunity. The next thing I want to talk about is the right to protect vaccine rights, or the right to a vaccine. State and federal lawmakers provide that, the laws provide that every individual has the right to the vaccine without identification barriers. Yet we know, and we're hearing continually, that some sites are requiring documentation, even as all groups become eligible for the vaccine. So let me just unpack this a little bit. This is really robbing our most deprived residents of their opportunity for vaccination. And this is an open opportunity for policymakers to step in and address these inconsistencies with community leaders. And this is really important as we push forward to vaccinate as many Michiganders as possible. My last recommendation is a standing one. It's mandate equity. So legislation is necessary to improve both hate crime reporting and increase accessibility for all individuals to feel safe and heard, especially amid a toxic climate of unjust racism, hate, and brutality. So we really need new initiatives that allocate funding for data collection and research for our institutions that are seeking to analyze and eradicate racism, including anti-Asian hate, which we've seen rise. We also need to continue to reduce cultural and language barriers that hinder hate crime reporting for all residents, especially immigrants. And so what can you do as a community member? You can volunteer. Go to the county's, help with the county's COVID response by going to gchd.us/COVID-19 volunteer / and fill out those forms. They are calling people back. They do need your help. So please sign up if you can. And that's it for today.
All right. Thanks for breaking it down for us, MK, and reminding us about the importance of enforcing legislation. I want to thank our community health workers and social workers for the hard work that they do. Make sure that you're getting those free CEUs. You'll see that pop up once you leave the webinar. So if you have any questions about those, you can email Gina at tremont@msu.edu. That's TREMONT3 @msu.edu, but also contact our own Marley at Sherrod7@msu.edu. She's running the slides for us today, doing a great job. That's SHERROD7@msu.edu. If you have any questions about those CEUs, social workers, community health workers, you guys are near and dear to our hearts, so we want to get you taken care of. But don't forget, 1 o'clock, 3 minutes away, you're going to head to our Community Cares, the HFRCC Community Academic Research Engagement Seminar. So the link is in the chat, but you can also find that information on the HFRCC website. Of course, everybody's already signed up for that. So, but just in case you aren't, you can find that information on our website. Today's topic is health in our hands. And so there's a roundtable discussion there. So you'll find out more information as well. So it is a different Zoom. So make sure, so you're not going to stay on this one. You are in fact going to leave this Zoom. But questions, head to the HFRCC website and we'll get you all set up. Don't forget, we ask that you would like us on Facebook, subscribe to us on YouTube, and email us if you have any questions at info@hfrcc.org. And you can always give us a call at 810-835-2130, and we will see you next week. We do have a couple minutes and we do still have some, you've got our questions that are coming in. If we don't get to them today, we will be answering them this week. And I want to just say thanks, Yvonne, for taking a break so that some of us could slide in and try this chair out in your absence. It's been great fun. So hopefully we'll get to do a little bit more stuff in tandem. So thanks for this opportunity. And I hope that everyone has a great weekend. Thanks.